The information expressed in the following podcast is intended for educational purposes only and was created by and belongs solely to Believe Limited and the Flow podcast and does not necessarily reflect the views of our sponsors. Please speak to your healthcare provider before making any medical decisions.
It's like a proper anatomy model supply chain for medical schools. I have to say though, I want more. It's hard to
needs to go with the clitoris.
Yeah, we need more. I just need more space. I need like a larger.
Like a
wait,
bigger
what was that, Sarah?
That's the clitoris.
Yeah, great.
Yeah, my 3D
Great.
clit.
Mm-hmm.
Yeah.
Oh, it's like a piece of art.
I think they could like work that into your model there, Jessica.
Yeah,
And you could have like external anatomy and then getting into internal anatomy.
Love it.
That's it. Because I really do. I want like an interactive cervix. I want like one that you can like interact with here. Wouldn't that be cool?
It would be very cool.
Just to understand.
I'm going to reserve my opinion on the interactive cervix.
Fair enough. Fair enough.
We could like see it like how it opens up to bleed. Wouldn't that be interesting?
It's going to be a really good conversation point. Put it on a coffee table in your house.
I mean,
Everybody feel really comfortable. They're coming over for a dinner party.
Oh yeah. My friends know. They know. They get lubrication every time they come over. So might as well have a cervix out there too.
That is great. Supplies.
A goodie bag.
Yeah, pretty much.
Most people are happy to get leftovers.
I'm like, hey, I got a new box of lube. I work at home right now. Do you want some lube? Like, please take it all.
Do you get the good
This
stuff?
is why.
Yeah, I get Uber Lube and Sliquid right now. And good clean love. Yeah, for now.
Oh, good clean love. Love that.
Mhm.
Well, that is why we open every time with, hello, I'm Jessica. Welcome to Flow. I'm here with Sarah Watson, sex therapist. And then Dr. Abraham, we say that she has like a lube super soaker gun, just like lube for all, you know? Sex therapist.
Mhm.
Shares it liberally with those that know her, right?
Exactly.
Those that care. And of course, we have Dr. Maggie Abraham of the Gyn Space, and we're going to hear about the inspiration and the art of gynecology and education. But first, we all want to know, how's your flow? I mean, I'm luteal. I want the world to know. I'm luteal. That's my contribution.
Samesies. Me too.
I love that you asked that. So the gynecologist among us has no idea. I love that you put menstruation front and center and just put us on the spot, to acknowledge our period. It's so fun. So I have an IUD, a hormonal IUD. So I don't really bleed anymore, which is great.
But can I ask? Yes, because Sarah also, has one. But do you feel the hormonal flow of when you ovulate? Do you feel still hormonal shifts?
No,
Oh.
not that I'm aware of.
Oh.
Mm-hmm.
Maybe I'm just less in tune.
Maybe.
Or
Or you're just awesome and that works out well for you?
Like you can like ride the raging river of hormones and you're like, no problem. What? That's what I do.
I love that.
Teach us your ways. Teach us your ways. We're going to get back into all of the Gyn Space right after this quick break.
This ad is brought to you by Von Vendi, Von Willebrand Factor Recombinant.
Hi, my name is Nicole. I didn't always feel empowered to speak up for myself or ask for the care and support I needed. Becoming part of a community and hearing other people's experiences helped to change my perspective. That's why my deciding factor is making my voice heard. To hear my story and access other helpful resources, drop by Von Vendi, that's VonVendi.com/patient-stories.
I'm so excited to talk to you with you, Dr. Maggie. Do you prefer Dr. Abraham? Do you prefer Maggie? How do you prefer to be addressed?
Oh gosh, call me Maggie. It's totally fine.
Maggie.
Dr. Abraham sounds very serious and official. So Maggie's totally fine. You can call me,
Great.
whatever rolls off your tongue, I am good with.
We want to honor all your study and everything you've done to be in a position of authority to help educate and inspire those just starting to learn about menstruation. What inspired you to work specifically with youth that are understanding menstrual realities for the first time?
Oh, that's a great question. So I'm an OB-GYN, right? An obstetrician and gynecologist. And I discovered the field, I think quite by accident. I think maybe it found me. So after I graduated residency, I wanted to remain in academics. And so I took a job with the University of Florida in Gainesville. And I was kind of like the young attending, like junior faculty. And they had a relationship with the health center, the student health center at UF. And one gynecologist staffed a morning clinic once a week. And so they selected me to be that person. And that was kind of my introduction into the field. I just loved working with young adults. And they also had a teen clinic, actually, that I staffed too.
Oh, that's awesome.
And I realized just how neglected the reproductive needs of youth are. And, people came to me with so many things that were just undiagnosed for years. And I just thought wow, we could have figured this out a lot earlier and saved them a lot of heartache and pain and discomfort and anxiety along the way. So I went back 4 years later and did a fellowship in the field, and then just discovered the breadth of it, the extent of the field. And that's kind of my story, I guess. Yeah.
Amazing. A fellowship that has a specific focus of study within the arena of gynecology?
Yeah, so pediatric and adolescent gynecologists are obstetricians and gynecologists who focus on the reproductive care of birth through to 25. And we're a small subspecialty field within the larger field of obstetrics and gynecology. There's only about 20 of us that graduate each year in the whole of North America. So there aren't very many of us.
Gosh.
But I feel like we're doing a lot of great work. Championing the reproductive health of adolescents.
Dude, that sounds like so few. Like my arts college had 20 graduating from my year, and that feels like so few people across North America. That's how many are added to the field?
Yeah, that's
That
crazy.
seems like a very small amount. So I'm just curious in ratio to other OBGYNs.
Oh my gosh. I mean, some residency programs will graduate, eight residents a year. So it's really small. And I think, that really brings to light just how neglected the reproductive care of our tweens and teens are, right? It's almost like an afterthought. They get kind of shuffled into the world of pediatrics, or they get shuffled into the adult gynecology world, and neither are they have their own unique needs, right? So yeah, and I think they really do a really great job of wherever they land, disseminating information to their pediatric colleagues and to their adult colleagues, and building capacity wherever they are for those physicians also to take care of the needs of teens and tweens. I think we've done education is a big mission of ours in general, and I think we've done a good job there. And also, I think just residents coming up now, it's so different. I graduated residency in, don't get me talking, but 2010. Oh my gosh. So I graduated in 2010, and back then, I graduated not knowing the field existed, right? And now I think, there's a curriculum, so residents are taught about the reproductive, how to provide reproductive care to teens and tweens and to the pediatric age population. And so, we formalized curriculum and different things. So I think the trainees of today are getting a more comprehensive education in providing care.
Yeah.
Thank goodness.
Yes. Yes. Because these needs have been neglected for too long, right?
Oh, for sure. I think what kind of strikes me is remembering like my first gynecology visit and being like, so that physician probably had no clue, right? Like being like I think I was 15 or 16 because I wanted to be on birth control because I had, my period, and it wasn't great. And I remember like that was terrifying. And I can only imagine what it would be like had I gone to someone who understood what it was like to be a teenage girl and knew what was going on with my body, which is very different at 15 or 16 versus 26, 27.
Yes. And even just relating
Yes.
to a 15, 16-year-old, right?
So different.
It's so different to relating to an adult. And, I think, when an adult sees a gynecologist, a pelvic exam is likely needed. Mm-hmm. When a teen sees one, a pelvic exam is likely not needed. And, things like that keep teens away from seeing a gynecologist, fear of, those things. There are a lot of barriers, and there's a lot more that I think we can do to step into that space and help our teens to, develop reproductive wellness from an early age.
Yes, please. Yes.
Yeah. For someone who it may not seem so obvious, what would you say those unique needs are that separate teen experience from adult, gyno experience?
Right. Well, when a tween or teen comes to see a gynecologist, they have a parent or guardian, who's also part of that picture. So you have to speak to both, right? So that's one of the things that are important. And often I think when a tween or teen comes to see me, it's because, they've exhausted all other resources, right? They've seen their pediatrician, or they've been to the emergency room. They've hit a wall and they're really struggling, right? Their periods are either extreme, either extremely painful or not happening at all, or really heavy. So usually they have a problem. And so there's already a precedent set where menstruation and puberty has been this really difficult thing. And so unpacking some of that, finding solutions for them, and then you may have like 5 solutions, but then you've got to find one that's going to jive with that teenager, right? Because taking medicine can be hard for any of us, right? And so finding what's going to work with their lifestyle and understanding like what their goals are, and then dismantling, some of the fears and anxieties around everything that's happened to them. I think their period can often be quite traumatizing. And I really think that if we kind of got in there earlier, we could really shape things differently for them. And for those that care for them too. I think it can be really hard for parents and caregivers, to see their children struggle. And some parents can relate because they've experienced something similar, like an adult with endometriosis. When their child has painful periods, they can often relate. Sometimes parents they feel at a loss for how to access help for their child, or for their, teenager. And so it can be really overwhelming. And these things are sensitive, right? And they're just a lot more common than any of us realize, just because so much of it is just not talked about. Periods are, still like
We talk all the time about normalizing the conversation around menstruation, but not normalizing the acceptance of the heavy pain, which is sometimes a block generationally because there's been an endurance model that's been handed down of how to deal with pain versus research and study that it can help lead to a diagnosis and maybe treatment for extreme pain.
Right.
So do you ever run into that with the caregiver and the patient dynamic?
Yeah, this idea of this is just the family norm. We just deal with it. And this idea for, that if you can't cope with your period, you are less than, and I think that's just so hard. And, teenagers worry, they just like the rest of us, they don't want to be burdensome to their parents. They don't want to cause their parents any anxiety, and they don't want to appear weak or not able to cope. And yet they're, having to push through and do all the things, right? Like school's demanding, sports are demanding, life is demanding, relationships are challenging. They're having to navigate all of that. And sometimes, a lot of fear and anxiety and discomfort and pain around a period, and also embarrassment when they're leaking through and soaking through at inopportune times. I mean, so many young women default from sports because of their period. And don't get help. Instead they start to rearrange their life to accommodate a period, right? Instead of managing the period to let them live the life that they want, So,
well, and right before we started this recording, I spoke with our amazing editor, Kay, and we were discussing this stigma of being a teenage girl and feeling like you're difficult, or feeling the stigma of being a challenge because your emotions might be hormonally shifting. And that, not wanting to be stigmatized as such when a young person is starting to menstruate. How do we enter the conversation about that? About not...
So I think, everybody's different, right? So, some, I find this in my office all the time, the conversation's so different depending on the tweener teen, where they're at, and honestly what they think of you, right? But some are really in tune with their bodies and really are hungry for knowledge and understanding, and then others just kind of want to know, like, how do I fix this? Like, this is what I want. But I definitely think 100 little conversations layered over time is so much better than one big conversation, that's just kind of overwhelming and just too much. So I definitely feel like we should be starting these conversations early, and there isn't a too early. Like, so often parents come to me and they wait, they think, oh, I don't want to bring it up until my child's in puberty. And I'm like, no,
terrifying.
Parts so important. Normalizing, vulva, vagina, uterus, cervix, making that part of just normal. And then, the idea of blood coming out of an orifice, for a kid, that's a lot, but they take their cues from those that care for them. So if we have those conversations early, we can really speak to, we can really provide a lot of reassurance early on and position them well for when those body changes happen, because puberty is about a tremendous change, right? And change is stressful, right? It is. And so I think positioning them well means conversation early on. And I think we can layer those conversations and build capacity for, a good reproductive story, right? And journey, even though it may be challenging, right? Because we know the reality of painful periods and heavy periods and some of those pieces.
Yeah.
I think we can do a better job collectively, like as parents and guardians, but then also even beyond that, as educators and aunties. It takes a village. I totally think,
Yes.
it definitely takes, a village to.
Yeah. Oh, and in the village of you speaking with so many starting to menstruate, what kind of language are you finding teens are using to describe their pain if it's extreme? Is there,
it depends again on their age, right? Some can be pretty graphic, and others are just like, it's really bad. They don't have the language in many cases because, people haven't invited them to have a conversation.
Right.
So things that I do is I'll give them a menstrual diary, or I'll start to be like, try to have them talk about what they experience and also what it's holding them back from. Like teenagers who don't want to go and hang out with their friends because of their period, or who just, are not participating in activities that they love because of their period, then their period's a problem. And I often find like on the other side, when we've made things better, that's when they really start to open up about how bad things really were. I think they have a lot of expectations on themselves about being strong enough to manage their period. And, my mom had a bad period and she got through it. And, it's not every day that's bad. It's just 3 days every month. You know what I mean? So I think they can be really hard on themselves. And then they don't want to look like they're copping out either. In my experience, I don't think people use their period as an excuse, And I feel like we often view them through that lens. And I think that's definitely the exception and not the norm.
What comes to mind, we've had other physicians on that are hematologists, like pediatric hematologists and oncologists, right? And what often happens, right, is that this doctor will have a patient come in and describe their bleeding, and then the physician, who Dr. Foley was talking about this just, right, where the physician then turns to the mom and says, okay, well, what's your bleeding like? And getting that generational history, and then also providing education for the adult in the room as well. Does that happen with your clients or your patients as well? Or is that something you kind of stay away from? And because you're talking about normalizing language and giving information out, but that comes it comes from the source, right? Whoever their trusted adult is. And if they don't have the information either, they're going to stay stuck in the cycle.
Yeah. Like in my practice, one thing that I found really valuable is definitely having time with the patient. And in my practice, that's usually the adolescent.
Right.
With their parent or guardian, and then also some one-on-one time as well, where I can really, because often they will defer to their parent, or their parent will kind of come in and be like, this is a story.
Yeah.
But I really want to get it from all angles so I can kind of piece it together. But you're right, like a third of women experience heavy menstrual bleeding, right?
It's crazy. It's crazy.
Of those, up to a third have a bleeding disorder.
Right. Hello, here we are, but no one talks about it.
We're like way underdiagnosing. So if we're way underdiagnosing, we're not managing this. Right. We're not managing it well. And I really think there's a gap in knowledge and awareness, and a real big gap in what's normal. And because adolescents take their cues from those around them, like if their parent has had really heavy periods and their parent has normalized that, then they're likely, there's a good chance that they're going to normalize it for their child too. And then it's if teenagers are not talking to each other about their period because, it's a private thing, it's not something you discuss, you hide your tampon, you hide your pad, you pretend you're not really on your period when you are, then they have no frame of reference, at least no healthy frame of reference. The American Academy of Pediatrics and ACOG, the American College of Obstetricians and Gynecologists, I think in 2008, and I could be wrong with the date, they came out with, we need to consider a period as a vital sign. So in the same way as we check in about blood pressure and heart rate, we need to be asking about a period.
Yes.
I think that's so important. The more that it's considered part of your vitals, like an indicator of wellness or unwellness, the more these conversations happen, the bigger, the better chance we have of providing adequate health care, reproductive care to women or to menstruators, right?
Yeah, right.
What do you think is most missing from, I don't know, either the education OBGYNs are getting or the education that teens are getting in order to locate the first step of, I need to look for a diagnosis?
So OBGYNs, I mean, when we do residency, it's a fire hose, you're learning so much. And if you never encounter, you may encounter an adolescent pregnancy, or you may encounter it really depends on your exposure. You're much more likely to be encountering adults, right? And so I definitely think there are some gaps there in education that I think, societies like NASPAC are definitely making inroads into. So also, if they never come to see a gynecologist, what chance have we of helping them, right?
Right.
So I think awareness is really important. Women and girls bleeding disorder clinics of excellence have really, where you have gynecologists, usually pediatric and adolescent gynecologists, working side by side with hematologists, putting these pieces together. Those pieces are really valuable. And when they exist in institutions, then, young women going to the emergency room with the never-ending period or who are anemic are automatically getting funneled into these clinics and then managed, right? So I think that piece, that infrastructure is really important. That's really changed over the past 10 years. A 14-year-old, it's not uncommon for them to go out and play, I don't know, a soccer game with a hemoglobin of 6 and just be I feel a bit tired. They have a tremendous capacity to function even when, they're operating on an empty gas tank. And so much gets missed. And I guess you can probably tell, I love working with teenagers, but I also have come to really admire them. Just their ability to just push through, their ability to just adapt, change, take on new things. It's really inspirational, I think teens I think they're a wonderful, a wonderful group to work with. They inspire me to do better for them. But also I have great hope for the future of medicine because I see these women come through and I feel and parents too, most parents want better for their children, what they had to deal with, right? Yes. And so I'm seeing more and more young moms come in and go I struggled with endometriosis. My daughter's now in puberty. What do I need to look out for and what can be done? Yes. So there is definitely a lot of awareness is building. And because of that, I think, the next 10 years, things are just going to look so different. And I'm really hopeful for the future. And I also think, it's our youth who are going to change it. They're going to demand more. And because of that, we're going to address things differently, right? Yes. And I think they're going to herald a ton of change, and I'm excited for it.
Teens are amazing. They're aware of so much because they're aware of how they're starting to become aware. They become aware of how they are being parented.
Yes.
Have such access to information. So they're aware of the fact that they are both going to become adults, but not quite there. So tapping into that level of awareness in an ever-changing society, I agree. Teens are like a powerful resource of energy, of understanding how humans are evolving, right? What's happening during that time. So potent. Is there anything you could share if you had known a period hack from your puberty experience that you wish you had back in the day when you were a teen?
Oh my gosh, I get asked a lot now about my own puberty experiences, and it's funny, I was thinking about them recently and how I even learned about a period.
Oh boy.
I think there's a difference between reproductive education and sex education, firstly, but
1000%.
I don't recall any reproductive education in school, but I remember sitting in the car, and my dad was a veterinarian, and it was me and him. Maybe my little sister was in there too, but I was sitting in the back seat and the radio was playing and he was driving, and the lady on the radio was talking about a period. And I remember leaning up and being like, Dad, like a period's a punctuation mark at the end of a sentence. What are you talking about? And, him being a vet, like he just took that opportunity to educate me on reproductive anatomy, but like started with animals.
Perfect, right? Yeah.
And I just remember slinking further and further back into the car seat.
Oh, no.
I never opened my mouth, right? And also kind of doing like some mental gymnastics, trying to relate, animal reproduction to human. But anyway, like at that point, way too embarrassed to ask any more questions. But it was not lost on me, that he was willing to go there. And so I think as parents, just be willing. You don't need to know all the answers.
Yes.
Just be willing to let your kids ask you questions and answer them the best way you can. But hacks. So definitely a puberty book would have been helpful.
Yes. Cool.
And there's some great ones out there now, just to kind of offset some of the animal reproduction. Really, God knows it took me a while. Med school was really helpful. But I remember I don't like carrying a handbag. I kind of stick my phone in my pocket and away I go. So when I discovered a Diva cup, I was like, this is great. Do not need to worry about carrying around a pad or a tampon. So that was wonderful. I'm a big fan of my IUD.
Yes, same.
And the other thing, like, as I look back, I didn't have horrible periods, but I definitely had very irregular periods through a lot of my years. And now I realize that that was not a healthy thing, right? And so I feel like understanding the menstrual cycle and understanding when, how often your period should come and when to be concerned. Those things are really important. I think we've come a long way in that space, thankfully. The other thing I would say is, as a parent, because I have 4 kids, so now I kind of look at just how I parent my kids and think about, as a mom, like, what are the things that I want to make sure for my children. And, as parents, we have these expectations, right? And so we expect our kids to somehow magically transition from all the awkwardness of puberty into like some sort of reproductive wellness, and then in turn into healthy sexual relationships later in life. Yet we don't have a roadmap for that. We don't have a roadmap to guide them to those places, yet we expect them to get there. And because of what I do, like having awareness of that, I mean, there's so much as a parent, right? That we're thinking about, are their friendships okay? Are they doing okay in school? Are they doing the activities they want? That we really don't prioritize health. And I think, these are actually the things that define us most as people, right? Our bodies are amazing. We need to take care of them because they have to last us our whole lives. And so I think about that a lot when my patients come to see me, and just helping them to value their bodies for all that it does for them, including their reproductive health.
I love that. Start with I think it's like emotional health and physical health. Like that to me, as I'm also a mom, like that is number one. Like, I mean, sure, would I like you to do well in school? Yes, but it doesn't really matter. Like I can't remember third grade, right? Like, sure, I'm sure I learned something, but like, I want you to be physically okay and emotionally and mentally okay. And then we can deal with everything else. But we have to have the language to talk about it. And if you aren't a parent seeking that out and you don't know how to do that yourself, I would say start there, right? And then to add on to what you were saying, Maggie, about having them ask questions, if you don't know the answer, tell them you don't know the answer and you'll look it up together.
Figure it out together.
That's my favorite. We'll figure it out together. So it's not like a hierarchy of like, I have all the information, right? No, I don't. Right? Let's normalize that.
Right. Yeah. And we're always learning. Things are always changing. Yes. And if we don't have that piece of, hey, let's go figure it out. And we're always looking for moments to connect too, right? Especially during those teen years, because developmentally, right, we know they're going to retreat into their own worlds, right, as they start to build and create. But they're great opportunities to just have those touch points. And they don't have to be exhaustive. They can be a couple of minutes here and there. Right. But like being that place. I tell my teens all the time, your parents are going to be the most invested people in your life, right? Yep. And so coming back to them for answers, like that's a safe place. And it's a real privilege as a parent to have that place, as they start to, drive their own car, but being in that passenger seat, in case they need you is just really important. Adolescence is a time where you get an opportunity to step into those places, and they can be super uncomfortable, right? Because we don't have all the answers.
No, or you have your own feelings about it, right? And it's like, okay, oosh, like it's okay
we have our own filters, right? This is where we apply, but nothing like a teenager to check that.
Yeah, they will get you. They know,
right?
Yeah.
So conversations may not always go well, but
and that's okay.
Come back to the drawing board, right? They want that knowledge, right?
Yes,
and they want that understanding. I feel like, porn is becoming like the default sex ed in America, right? Maybe the world over. Yes. But I think it's particularly hard for young women, and they want another place to go, right? And so I think let's go there with them and help them build, their reproductive stories.
Yes. As a sex therapist and sex educator, need to give them the information, right? Because then if we don't, they land up in unhealthy relationships with others or themselves, and then they come to me, right? And they're like, I've had so many clients say, I wish I would have known this. Like, how come I didn't know this? And we have to have this whole process of grieving because they didn't have this information. And it starts, I know my daughter's only 6.5, but we have started I talk about this all the time on the podcast. We have started well before right now talking about our bodies and what's
because they want to know what everything is.
Right. And we're like, she's like, oh, now she's like really into my boobs all of a sudden. I'm like, okay, cool. She's like, I got your booty. Like, yeah, great. Lovely. Yep. That's great. okay, cool. Just make sure you ask for consent, like that's
Right.
normal, right?
And that's the other piece, right?
Mhm.
Consent.
Yes.
All those things are modeled in those small conversations early. And
Exactly.
so I think our sexual health really does. It encompasses, our physical, emotional, mental, and
Yes.
our social well-being,
Yes.
right?
Yes.
Like not this little, small little thing off on the side that
No.
really is untalked about.
Right.
It's
Yeah,
in all those pieces.
I, again, say this all the time on the podcast, but talking about pleasure too, right? Pleasure
Mm.
with your own body, with maybe a partner, but then in your day to day, it doesn't have to be erotic, but that we should be well aware of that and how our cycle can impact pleasure. And that's okay.
Yes.
Let's talk about what that means instead of
But
it
it's
being like this thing.
denial about our whole, if that's all in
Yes.
shutdown, how are you going to embrace the highs and the lows, right?
100 conversations, you had said earlier. And I
Yes.
think it's just really letting that digest in, because the idea of, one big conversation is definitely going to be more intimidating, more overwhelming than little pieces of intel being repeated and delivered. Is that the educational style that inspired the Gyn Space? I want to take one moment to talk about the amazing resource you've developed from your work and passions, the Gyn Space. Am I saying it right, or is it GYN Space?
Well, yeah,
Okay, good.
the GYN space, the Gyn space, whatever, however you want to say it. So I've shared a little of my story, and so I've worked in a number of different settings. So for large healthcare institutions, academic settings, and I've enjoyed, they've all worked for me at different times, right? I've gotten to do some amazing things, some great research, and been part of, starting programs and different things. So it's been fantastic. But in this season of my life, I started to realize, when I first started in Adolescent Gyn, it was all about education, let's figure out, how we should be managing this. What's the recipe for success in managing these things and diagnosis? And then what are the best treatments? And then now in this season, I feel like education's great, but partnering with adolescents to understand where they're coming from and to understand where it is they want to go, what their goals are as menstruators, has just become, I felt like I was giving them all this information and then being like, so why won't you incorporate these my wisdom, And I thought, it really takes time and relationship building. And healthcare has evolved a lot. And I feel like over the years, the amount of time you have with your patients has gotten eroded. And, also just to speak a little bit to sometimes teenagers and parents are just they're not on the same page, and helping to bridge that conversation also takes time. And so for a long time, I've been really passionate about creating a unique space for teens, where, their reproductive health care needs can get met kind of on their terms. And so that was kind of the thought process behind the GYN space. And then I was just at a space in my life where I wanted a little bit more flexibility in my work life anyway. So I thought, and I stepped away. And then I was like, I really feel like now is the time that I can create the GYN space. And so I'm early days in it, so I'm not sure how it will all evolve, but I'm really excited about it. And I'm enjoying it, and I'm enjoying creating it, and building it and hoping the patients will come. It's a virtual telemedicine practice. So anybody in the state of Florida can access me for their reproductive care. And
we know Florida needs you.
Yes, that's what I was saying earlier.
Yeah.
Yeah. And I'm hopeful to connect people a little more. So to have groups that I would moderate where teens can come and share their menstrual concerns. Maybe like, you take 10 young women with PCOS. They don't all look the same. You take 10 young women with a bleeding disorder. You take 10 cancer survivors. Or you take, 10 parents with a developmentally different child. All their reproductive stories are different, and yet there are similarities, and there's a lot of commonality, right? And so I think, sometimes in healthcare, it's hard to connect people. And so creating the Gyn Space, I was hopeful too, that for those who want to connect, being able to do a little bit of that, but then also providing the medical oversight. So I'm excited. You'll have to have me back on to talk about it. And then I still do a little bit of obstetrics and stay plugged in with the residents at UCF. And so I still get to retain like a lot of those pieces that I've been excited to do over the years too. So, yeah.
Oh, I love
amazing.
That. Created balance
really
for
cool.
yourself. Yeah, that's wonderful.
Yeah. Yeah.
Inspiring, as a provider who's giving so much, and that you've shifted from education to partnering with the youth. That's a cool evolutionary word phrasing, wordsmithing to bring to the because it's education, but it's sharing in a different way. Very cool.
And just helping them incorporate it into their lives. But in order to do that, you have to understand their circumstances. And they're not going to open up about that right away, right? They've got to learn to trust you a little, and you've got to build those relationship pieces. So I hope to have, the opportunity to do that.
Well, we're happy for you. We're going to look forward to building the relationship with you and definitely having you back to hear how the Gyn Space evolves. Thank you so much. Listener, you can find out more about the Gyn Space in our show notes, information about Dr. Maggie Abraham. Maggie, thank you again. Be back with us the second Thursday of every month to keep flowing.
Thank you, guys. It's been a pleasure. I've really enjoyed it.
Oh, thank you. Thank you. It was great.
That's great.
Flow is produced by Bloodstream Media and edited by Kay Vermeil. Shout out to Flow's creative director Amy Board and hosts Jessica Richmond and Sarah Watson. New episodes are available the second Thursday of each month.
Hey, that's the day after I start menstruating.